To
And we're still here at Meet the Daily Grind Cafe as we come into the far turn, I guess, for civic engagement. Where do we go from here? My name is Raymond Tyler, and I'm going to give the opportunity to speak back to our panelists. Nathan, you haven't asked a question yet.
And I'm about to, thank you. So we talked about the immigrants, both of you. And I agree that America has caused a destabilization, which has led to more people coming to the country. So thank you for acknowledging that. But as an educator, I do want to jump in education. How would you address, either one of you, the financial shortages that are occurring because of your administration within the school districts throughout the state of New Jersey?
Yeah. So the one thing we definitely have to do is reinstitute the Department of Education in a true manner that it speaks to providing, ensuring that every child, regardless of zip code, gets a quality, equitable, comprehensive education down the board. And again, we have enough money in order to do this. We don't have a money problem in this country, we have a priorities problem. And right now our priority is a war that is completely unjust and never should have been started in the first place, as well as making sure that special interest groups and corporations continue to get wealthier than they already are. So that being said, the money to come into our schools so that we can provide them with the funds to offer the services that they need for their children, including mental health services, educational services for those in need that might have learning disabilities that go into it, and supporting our teachers, because our teachers are hugely underfunded, not only in what they make, but in the resources that are available to them. But we also need to make sure that our kids have access to materials that they need too, that they have the up-to-date textbooks, that they have access to technology that will get them into, make them competitive as they go forward into higher education as well. And when we talk about higher education, I'm a proponent for free community colleges, and we need to also reconstruct or rethink how we're doing loans for and financing for our kids that are going through higher education. Right now it's a very predatory type of environment where we have people who pay for 10 years on their student loans and they still owe 6 figures. It's not going down. There's as much, if not more, as much as a mortgage. We want our kids to be able to thrive, compete internationally, and be able to come home to work as well.
Thank you.
So I'm going to stay focused on public school education. I have a plan, and by the way, all my policy outlines are on my website, tonight4.com. You can go there for greater detail. And more importantly, you'll see how I can plan to pay for each policy. So when it comes to education, improving the amount of money we bring back to our schools, there is an untapped resource that we can bring a significant amount of money back, and that's in cannabis. The state of New Jersey, along with 24 other states, have decriminalized cannabis. What I want to see happen on a federal level is that we decriminalize it there. We move it to a Schedule 4 so that people who have medical needs can still potentially get it through their prescription companies. And again, this is going to be in those states where it's allowed. But the reality is that, from my perspective, I engage in my sins. I like a glass of scotch, and my wife likes a glass of wine, and some people smoke. So the commonality in all this is that we pay a tax on it, a federal tax. So we decriminalize cannabis. We could apply a federal tax similar to that goes to cigarettes, and we could collect that money, and almost every single penny, by law, because we're going to write this, has to go to funding public school pre-K through 12 education. Only to the 25 states that have decriminalized it. And in addition to that, there's a small carve-out. There's 2 small carve-outs. One for the administration of this process, and 2 for fighting recidivism for those being released from federal prison, having been incarcerated for years, if not decades, on a non-violent marijuana, cannabis-related offense. We have to help them get back on their feet and avoid them having been institutionalized over that to not create or get engaged in more crimes because they don't have any other opportunities to do so. So back to the funding. Now we have funding. The money, again, through this law, has to go to the school districts. The school districts will then decide what they're going to spend the money on, but here's the criteria. It cannot go on superintendents. It cannot go to assistant superintendents. It must go to the buildings. It can be used for capital improvements. It can be used for educator salary. An educator is not just those in the classroom, but everybody in the building. It could go to school trips, supplies, bringing back VOTEC. Many high schools have lost VOTEC programs. And they rely heavily on the county programs, but they're so full that it creates wait lists. You know, when I went to high school, and I'm not going to say when, we had VOTEC right in the building. We had it's called D-Wing. And you had electronics, you had wood shop, you had auto mechanics, and you had culinary. You can stay in high school for all 4 years and learn how to do these things. We can make that even better by encouraging districts to engage in those who haven't already, partnerships with the trade unions, so that over the summer, the kids who are serious about becoming a carpenter graduate can, over those 4 years, go work in that field in some capacity and bring that lesson back for the next year of education. So by the time they're done, they're ready to go into an apprenticeship program. This doesn't take a heavy lift, but it will create a windfall of money for our education. The reason I say by law is we got to lock it in. If we don't, somebody's going to come along at some point and say, why are we sending all this money back to these school districts when we need other things over here? So that's why I want to lock it in with a law to make sure it goes where we intended to go. I don't have projections on the money because we tried to develop a model to show us, but we can say without any doubt that it's going to be a windfall of money, limited to the 25 states. Now, if another state comes online and they say, okay, we want to decriminalize cannabis, you're kicking in, you get a piece back. That all goes to, and then Terri actually brought this point up earlier, that New Jersey is a donor state. We send far more money to Washington than we get back. In fact, we're dead last on the list of 50 states that receive federal funding. I'm not saying that states like New Mexico is number one, don't need a lot of help, but we don't have to be last. So I want to make sure that we develop ways to bring more money back. This is one of them. That we're kicking in. We allow people to buy recreational cannabis. And by decriminalizing it too, we relax a lot of these regulations that dispensaries have to go through. And they can use regular banks, not just credit unions. They can take credit cards, and it'll help us better track the money. Because if I was an underhanded person, I have dispensaries in all 25 states that's going to help you launder money. And I don't care how many regulations you put in place, I'm going to defeat them. So here and now we can actually make it a little bit easier to track the money and not necessarily defeat it altogether, but make it harder for criminals. We have to be cautious that as this grows, we'll see corporations come in and try to buy up all the dispensaries. So that's on the state level, but I just throw that caution out there. Next question.
Yes, this question is about access to healthcare. We've had millions of people who have lost access to Medicaid and Medicare. We have an aging population that increasingly needs more access to long-term care. We have a lack of access to mental health treatment, drug treatment. And we have more and more unemployed Americans who don't have access to healthcare. What policies would you enact to make healthcare more affordable and accessible? And what would you do to ensure that insurance agencies, insurance companies don't get to do this practice of denying claims that are legitimate?
Sure. Again, I'm going to set it up a little bit. My background, in addition to law and law enforcement, I also have a Bachelor of Science in Business Management, and I have an MBA from Drexel's Business School. Using those skills, I looked at the Medicare that we have currently. And I had my son, I'm going to go and give him a plug, a Howard graduate. He developed a AI program that showed us how we can make this actually work, and use me first as an example. For my insurance, and by the way, I get supposedly a discount because I'm allowed to use the state benefits, is about almost $1,600 a month, with not including eyeglass and dentist thing. That's separate. But the bottom line is we pay that much just for my wife and I. And we have a pretty decent plan, it's not the Cadillac, but it's not too bad. We then took Medicare and we combined parts A through D into Medicare. So it was one policy, one body. And we ran the numbers and it came out that where I currently pay $1,500 and some odd dollars, it goes down to $600 and some odd dollars. Why? Because it's non-profit. It's not a dividend that's gonna go out. It's not a share that's gonna go out like insurance companies have. You know, we ran it with younger folks, my kids, and it came back their premiums were less. It also showed us that after about 10 years or so, there's a significant amount of money in the fund that people who are 64 years and older don't have to pay any additional money for this type of insurance. And I say it that way because it's not free. You pay for it your entire working life, one. And two, because you pay for it, you shouldn't have to pay for it beyond a certain age. And we still have the resources to get it done. I believe this is a good first step to Medicare for all, but it's a start. It's not, Medicare for all has been a victim of one of the greatest marketing techniques that Republicans have ever employed to somehow make it a bad thing, even to those who would benefit most greatly from it in their own party. So, okay, we deal with that. And we rebranded that this is an option that you can take or leave. You want to go with the private insurance? We're not bothering with that. In fact, going back to the marketing aspect of my education, there's a thing called the invisible hand when you talk about consumers and stuff. And the invisible hand is the consumer. And if they don't like this cup of tea, they go somewhere else and buy a cup of tea. And now you either change that cup of tea, lower the price of that cup of tea, or do something else. Here, where we have an opportunity for people to get health insurance at a significant savings, half price almost for me, a little bit more than half price, $100 over, for me and my wife. Now, what's Blue Cross Blue Shield going to do? What's Aetna going to do? Either they're going to, first they're going to, as one congressman told me when I pitched this idea to them, they're going to line up around my office and try to give me checks to change my mind. But that's not going to work. We're going to be nicer than they do to Georgia, because we'll give them water and sandwiches while they wait forever. The other is they become competitive. And they stop with this gouging of America. Every year, I can't tell you this, I've been retired for 13, 14 years, something like that. Every year I go to the website and look at the other health insurance plans to see if I can get something cheaper equivalent. $8 more here, $6 less there. To me, that's collusion. If you have, everything is all locked in, Aetna's expenses is the same as Blue Cross Blue Shield, is the same as some other insurance company, nonsense. So they all got together and decided what these rates are going to be and what they're going to gouge us on. We got to break that up and break it up by giving this real option for people to buy into it at a significant savings that I believe is going to totally change the way our healthcare system is. That's not to say that we don't have to restore the funding for the Affordable Care Act. We must restore the funding. We want the subsidies. We must restore the expansion of Medicaid. All these things happen, and we know we have an attack coming in November on Medicare. We have to defeat that as well. So all these things are on the table, but I think we start by opening up Medicare for all and allow people to buy into it as opposed to giving it to it free for now. Build it up without any government subsidizing it, and as it gets stronger, as it gets bigger, we can now move into a public option. Because all those naysayers who say, oh, you're going to bankrupt America, you're going to do this, you're going to do that, put it to bed. Done.
Yep. I also am a proponent of Medicare for all as a first step going towards universal health care. We need to have comprehensive coverage where it's for the eyes, the ears, the teeth, the entire body, including robust mental health, prescription care, and long-term care for our seniors. But in addition, full reproductive care as well for both men and women going forward. With right now, the way it's set up too, is that we have a focus on emergency care and crisis management. We need to turn the script on that and work on prevention. And starting with yearly checkups, even as young as the age of 5, where we're discussing mental health in those checkups to go forward. So we're catching things at the beginning and not waiting to be reactive towards the end. And senior care is very important to me. My mother, I left my job to become a full-time caregiver for a parent with dementia. So I know what it's like out there, and I have a daughter with significant mental health issues. So I get what's out there with trying to fight insurance companies in order to make sure that your loved ones get the care that they need, as well when you've paid into it and you still have to fight with them for 6 months to honor an agreement that they keep changing the goalpost on, when you were already over the touch, you already made your touchdown, and they still are like, they say they're taking it back. We know that United Healthcare in 2024 was $18 billion in profits at the expense of having $625 million in medical debt for the American people, and that's something that is just wrong. We should be helping each other to move forward and to get better. We do know that when we have better preventative care, we have better outcomes at the end. We're the only industrialized nation that does not offer universal health care to its citizens, and we know from looking at those models that it ends up becoming cheaper because you save on the administrative costs as well.
I wanted one more caveat to that, to what I proposed earlier. We have to increase the amount of money we pay to physicians to the level of the private insurance, if not better, so it's now more widely accepted. And we don't have to hear physicians say, I don't pay that.
And I had one thing that I forgot about, equity. Right now, we have a very big disparity between races and cultures in how the medical system, and even gender, and how it addresses people's needs. And we need to get to an equitable scenario with our healthcare as well, that it takes women's needs as seriously as it does men's needs, that if we look into the maternal and the infant mortality rates for the African American communities, as well as reaching out to the immigrant communities that have other needs as well.
I'm sorry to cut this segment short. You guys were great guests. I know you have another engagement that you have to rush off to. For those of you who are watching and listening on radio, this is a civic engagement where we go from here, special from AtlanticCityFocus.com. For those of you who are listening, don't go anywhere, because coming up next, we have Sean Riggin, who has been the head of law enforcement for both Pleasantville and Atlantic City. He wants your vote for Atlantic County Sheriff. We're going to talk to him right after this.
Although it's been less than 12 hours, we've seen you again.